Well, welcome everyone. My name is Theresa Hawley. I'm the executive director here at the Center for Early Learning Funding Equity, and I am excited to have you all here join us today for another important report from the Shortchanged Project, where we're looking at the sum total of money that's spent on early care and education in communities across the country. We've got a packed agenda here today that we'll be talking through some new findings of the Shortchanged Project in a brief that is out just this week. And we'll be talking to our friends in South Carolina about their advocacy journey and using funding data to support the work that they're doing. And then we'll have some rich discussion, and we hope that all of you are going to be primed to be putting your questions in the chat. We will have time at the end here to have some questions from the audience, and I look forward to hearing what questions you have about this data and how to use it well. So I have some introductions to make here. So Michelle Bezark is our Senior Policy Research Associate at CELFE, and she leads our work on the Shortchanged Project, and she writes and researches about early childhood policy, and we're excited to say that she is the author of a forthcoming book, Making Babies Count, which will be published by Cambridge University Press in May. So look forward to announcements about that from CELFE, because we're going to want to celebrate her and all her work. We're delighted to be joined today by Megan Carolan at Executive Vice President of Policy Research at the Institute for Child Success. Since she joined ICS in 2015, Carolan has worked in multiple roles advancing system-level opportunities in early childhood policy. And she previously served as a policy research coordinator at NEAR and at CELO. So she has a lot of experience with this kind of 50-state summaries of what is going on across the country, and now specializing in her own state. And of course, Joan Lombardi needs no introduction to most of us, but I'll give you one anyway. And so Joan serves as the principal and adjunct professor at the Center for Early Childhood at Stanford University, as well as being the co-founder and senior advisor at the Georgetown Collaborative on Global Children's Issues, and is senior scholar and adjunct professor at Georgetown Thrive Center on Children, Families, and Communities. And Joan, we all know, has had many roles in federal government, including serving as the first Deputy Assistant Secretary for early childhood development in the Obama administration. So we got a great panel for you today, lots of information to share, lots of things to discuss. So I'm going to turn it right over to Michelle to get us started and talk to us about new findings from the Shortchanged Project.
Thank you, Theresa, and hi, everyone. We are so glad that you were able to join us today. As Theresa mentioned, I'm Michelle Bezark, and I'm the Shortchanged Project lead here at CELFE. So we have some really interesting new findings to share with you today. But I also want to quickly go over and just give a review of what the project is for those of you who are new to us. So a bit about the project. We know that in the United States, we invest the least in children when it matters the most, when they are the youngest. But it's actually incredibly challenging for us to suss out exactly how much we spend on kids' care and education before they enter kindergarten. And this is because there's no single federal agency that is tasked with analyzing this. So at CELFE, we decided to track public investments across age groups, funding sources, and geographies in order to give advocates and policymakers useful information as they consider how to best allocate resources. Now, of course, we know that children need a whole wide variety of supports in order to thrive, which include economic supports, community supports, and healthcare. But at CELFE, we really specifically focus on early care and education, which we shorthand as ECE. So that's childcare, preschool, early intervention, and preschool special education services, and then home visiting for children from the time that they're born until they enter kindergarten. And even narrowing our focus just to ECE is really quite complex. At the federal level, we consider all 12 of the funding sources over to the left hand of the slide as part of the ECE financing system. And then things get even more tricky and complicated at the state level, as each state has its own fundings, complex funding systems for how they fund their early childhood systems. And then we go ahead and we disaggregate all of those funding systems into 3 different age groups. So infants and toddlers, preschoolers, and then we compare that to school-age children. And for those of you who are interested, we have a lot more detail on our methodology and our reports and in past webinars, which you can find through our website. So we analyze per capita ECE expenditures. So that's the number of children that are born in each age cohort, rather than the number of children that are being served by any given program. And then we compare that to per capita K-12 investments. And when we do that, we see some really dramatic differences. So this is kind of our headline slide for the entire project, but nationally we find that we invest 84% less in children before they enter kindergarten than after. And so when you look at these national averages, you see that federal investments are relatively even across age groups, and that it's really state and local investments that are driving that really dramatic funding gap. And so put another way, the ECE systems are really heavily dependent on federal funding. This is true across the board in every state, but as you can imagine, it really varies a ton when you drill down state by state. And I do need to pause here and just point out that the data that I'm focusing on today is from 2022. And that's because that was the most recently available public federal expenditure data from the federal sources that we use. Now the feds are just coming online with their 2023 data, and so my team is working really hard to collect and analyze that both at the federal level and the state levels, and re-release this analysis this coming later this spring. So please stay tuned for that. Now, part of the motivation for this project is that we knew that many states are spending a lot more on their ECE systems than is captured in national reporting. So we went directly to state budgets to get the total investments that states are making. And when I say national reporting, I mean that what states are required to report back to the feds, in addition to the amazing data that our friends over at NEAR collect on what states actually spend on preschool. Now, going through state expenditure budgets is much easier said than done. We learned the hard way. Within each state, ECE programs sit across multiple different agencies, and expenditure budgets are not always publicly available. But with a hefty dose of elbow grease, we did manage to do it in all 50 states. And we are really glad that we did, because we found $6.7 billion in state spending that was not being accounted for. Additionally, we found 18 states spent over their required CCDF match and MOE for childcare, and all but 3 states were spending significantly more than what was being reported nationally. So with this accurate data, we were able to rank each state's per capita investments in ECE and then compare it to K-12. So over to the left of the slide, you can see New Mexico, Vermont, and New Jersey spent the most state dollars relative to K-12. And over to the right of this graph, you can see that Idaho, South Dakota, and Mississippi spent the least per capita on their 0 to 5-year-olds than on their school-age children. And we have a much more detailed brief on why and how we rank the states, which we published back in January, and we can drop in the chat if you're interested. And we hope you are, because I really love that brief. Now, we know a lot has changed in many states since 2022, and we absolutely want to give credit where credit is due. This is just one example from a state that we work with at CELFE in Massachusetts. With just one program, their C3 grants, the state has committed over $475 million in additional state investments from 2024 and beyond. So what's really significant here is that this will shift Massachusetts rankings from being mid-range to low in our analysis to being much higher up in our analysis. And this is why we think it's really critical that we update this analysis annually, because we know these state investments are not static. So even when we account for all the additional $6.7 billion that we found in that states are spending on their ECE systems, we still find that states are substantially underinvesting in their youngest learners. So here you can see the percentage of state versus federal contributions to total ECE investments in each state. So over on the left, you can see New Jersey, Vermont, and Illinois contributed, 60% or more in their state funds to their ECE systems, while states like Montana, South Dakota, Idaho, and Mississippi were over 90% reliant on federal funding sources to prop up their ECE systems. And this map really highlights the two largest federal programs that states rely on, which are the Child Care Development Fund and Early Head Start and Head Start. And what I think is really important to highlight and drill down on here is that even when the states that are spending the most on early care and education, so states like Vermont and California and Illinois, rely on just these two federal funding streams for over a quarter of their ECE total state spending. Now, we also found that when we disaggregate funding by age group and source, federal programs provide the overwhelming bulk of support for infants and toddlers. And here you can see what that looks like. So only Illinois, New Jersey, and Pennsylvania contribute more state revenue to infant and toddler care and education than they receive from federal funding, meaning all other states are really heavily reliant on federal investments to support this age group. The good news here is that where states are investing in ECE, it looks like they're they're investing more evenly in their preschool system. So so federal and state and local contributions to pre-K are much more evenly distributed across funding sources. And then what's also I find interesting here is that federal and state and local investments in infants and toddlers and school-age children are kind of nearly the inverse of one another. So if you look up at the top at Alabama, infants and toddler care is 85% federal funded. And over on the right-hand side, you can see it's nearly the opposite for K-12. So state and local is 82%. So the overall takeaway, on average, states spend 69% less on infants and toddlers than they do on preschoolers. And we think that's really important information for advocates and policymakers to have as they consider where to best allocate resources. Now, as Theresa mentioned, we released a new policy brief this week, which we hope you will read and share, that delves even deeper into some of these topics. And Maggie can put the link for that in the chat as well. And you can find all of this information on our website. So we really wanted this information to be not just interesting reports, although we do hope you find them interesting, but also really usable information for policymakers and advocates who are out in the field trying to work for more resources for youngest learners. So we built out this website. You can find all of our reports and briefs there. You can find access to partner websites and helpful tools that our partners have made. And then you can also find this really handy interactive map, where you can compare state investments. And when you click on each state, you can find a downloadable double-sided fact sheet with all the information and analysis that we just shared. And then it's also really important that I note that you can also download an Excel file with all of the state and federal budget items that we pulled. So that you can make most use of that information for your own state. And I need to pause here and just say that building out strong partnerships with administrators, the right administrators and advocates in each state, is really the way that we make this tool as usable and accurate as possible. So if you or somebody that you know is a budget expert in your state, or in your city, please do reach out. Maggie can drop my email in the chat. I really would love to connect. And don't be surprised if I reach out to you. So with that, I would have to say thank you to the members of our advisory committee from all the listed organizations, and for support from the Heising-Simons Foundation and the Saul Zaentz Charitable Foundation for helping us build out this website. We hope you'll check it out and use it. And with that, I will pass the mic over to Megan, who can tell us about how she actually used this data and analysis and turned it into action with her partners in South Carolina.
Great. Thank you so much, Michelle. Let me just get my screen share going here. Okay, good afternoon, everybody. My name is Megan Carolan. I'm the Executive Vice President for Policy Research at the Institute for Child Success. As of this week, I'm celebrating 11 years there, so quite a bit of time. The Institute for Child Success is a nonprofit, independent policy and research organization. We're based in Greenville, South Carolina. We were founded there about 16 years ago. We do still maintain a pretty heavy presence in South Carolina, do a lot of our policy work there specifically. I myself am speaking to you today from a rainy, gray New Jersey. We have our staff nationwide and we work nationwide, which sometimes in our history has been difficult to navigate that local, state, national dynamic. But in this situation, where we wanted to start better understanding the federal funding landscape to help our partners, was really a tremendous asset, sort of being able to code switch between different partners and different lines of work. So a little bit, just very briefly here about ICS. As I said, we're based in South Carolina. We're specifically based in Greenville. The entire time I've been working in South Carolina, Greenville has been up and coming. Greenville has been hot. Every year, a new travel profile comes out or a new ranking that says, one of the best places to live and work. And this is interesting, one, to, be working in a community that is going through so much growth, sort of struggling with some of the right sizing that goes along with rapid growth, South Carolina in general handling this. It's also one of the most robust philanthropic communities in the state, what we would call the upstate of South Carolina. And that really influences how we were able to come to the table and do the type of data work that we've been able to do in the community over the last year and a half. I do want to point out again, we work at the federal level. We're a member of numerous policy coalitions. We do work on the Hill. We also across the last 2 years, 23, 24, worked in 33 states across our small but mighty team. And yes, we are all jealous of the colleague who had that project in Hawaii. I'll just answer the unasked question there. So I want to take everybody back to a time that is not my favorite to talk about, which was the very fast-moving federal landscape of early 2025. So sort of shortly after the inauguration of the federal administration, things started changing very quickly within federal funding streams, within executive orders. And this is important to go back to because I think it really helps us to understand how ICS entered the conversation where we were and the federal data work that we've undertaken to support partners and really help inform our advocacy work. As was noted in my introduction, I cut my teeth on data at the National Institute for Early Education Research. I ran the preschool yearbook for a few years, which is just such a way to get a crash course on data, on what we know and what we don't know about how we can follow enrollments and trends and funding, which is a skill set that served us really well in trying to make sense of the funding flow from the feds down to local communities to understand what changes could mean for local communities. So just to take us all back for a moment, this is what was happening January, February, March of last year. Sort of right off the bat, many of us might remember January 29th. That was a federal memo was issued. I guess an executive order was issued that was going to freeze basically all funds going out the door to nonprofits, until there was additional review in line with agency priorities, DEI concerns, et cetera. That was sort of a shockwave that went through the sector very quickly. There was a lot of uncertainty about what was happening. Very quickly, some court cases followed, different cases, different jurisdictions, different plaintiffs. And I think for a lot of us, it was a recognition that federal funds could no longer be a thing that we just looked at during the appropriations process or when a notice of funding came out. It needed to be a process that we were monitoring and engaging and understanding. Even when things were sort of walked back, this executive order was rescinded or struck down by the courts, we were still seeing a lot of under the hood changes to how the work of federal funding was being done. We were seeing contract cancellations under the really broad terms that the federal government gives grantees with funding contracts there. We were seeing reductions in force, in ed and HHS in particular, which many of us work really closely with. That means, more paperwork, fewer people to manage it, and delays pulling down funding, getting technical assistance. And so really, we were finding ourselves in numerous conversations in Greenville, in South Carolina, where folks kept sort of looking at each other and saying, what is going on? What does this mean? What does this mean for your funding source? What does this mean for my clients that I serve with that funding source? Where are we going from here? And we didn't have the clear answer for that, right? We were in these conversations, we were in rapid response groups. We worked very closely with our partners at Greater Good Greenville, which is the county nonprofit association, and with Together SC, which is our state nonprofit association. I'll just take a moment here to say that if you're not already working closely with your state and local nonprofit associations, do so. I mean, just a tremendous font of information to help navigate some challenges that many of us had not monitored previously. I have never really followed what was going on with court cases, but now, especially for things like Head Start, these are the decisions that are shaping some of the work. And so just to recognize that there's a lot of resources out there, maybe we haven't tapped into and we should be sure to. And so we were hearing these questions. What do these changes mean for our program, for our organization, for our community? Well, this brought us to a larger question of, well, who currently gets federal funds in Greenville, in South Carolina? What is it for? What are the streams? We were hearing things like an interest in defunding the Department of Education, right? Which is a very blanket statement. But then we had to start better understanding the nuances when it got past those headlines into, well, actually, we're looking at preschool development grants. Who gets preschool development grants? Who would be impacted if those disappeared? So really digging below the headlines. Offhandedly on a call, somebody mentioned the funding source of usaspending.gov, which is a government website, sort of committed to funding transparency. All federal grants and subawards, with some exceptions, get tracked through here. Medicaid, TANF, SNAP get tracked to the state level, but then because those go to individuals, it doesn't get tracked from there. An incredibly robust source of data, what a colleague of mine would call drinking from a fire hose, though, because you get into this system and you can see things like the date a grant was issued, what competition number, who the grantees are, who the subawardees are, but it's hard to really draw clear conclusions from it. So what we were able to do with support from our funders, who we're very grateful for, they really saw this work as within our mission of supporting the field in South Carolina, supporting the human service field and early childhood in particular, was digging into this and helping to build a tool that we could share through webinars and through the data set to help make sense of this. So I'm going to share a little bit of high-level findings with what we found, and then I'm going to take you through a few use cases of how we've been able to now use this. This is not a spreadsheet that just sits on my computer. It is something that we're actively pulling information from to better gauge advocacy efforts to help communities prepare for changes. So first, what did we learn? We focused our analysis just on funds that were arriving to nonprofits and government entities. So no for-profits are included in this. At the time that we started this, that was really the highest focus of the inquiry. We also looked at a 2-year span of 24-25. We didn't take an average, so all of these are 2-year numbers. Part of this is because South Carolina received significant post-hurricane funding, emergency funding in 2024, which skews the numbers a little bit there. So we found that across that 2-year period, 24 billion with a B dollars were coming into just the state's nonprofits and government agencies from the federal government through a combination of direct awards, subawards, contracts, grants, collaborative agreements, just a really large range here. I want to give some context there that the 24 billion represents about 4% of the state's GDP over this time. When we take into account the 2 to 3% GDP growth annually is sort of what's considered the ideal, it's clear that if these funds were to disappear en masse, it would be a significant detriment to the state's economy. And so I think, first of all, it was helpful for us to get that context that these funds are vital to the state's economy. And that means that there's going to be vested interests in protecting them and understanding them. So from our analysis there, we wanted to first look at how the funding first arrives in the state. So out of that 24 billion, 18.3 was going to state agencies, which then will routinely contract or subaward out. We see this with, many government programs go through the states as their first recipient. The data set does then track those subawardees who gets funds after that. But we found that sometimes that data tracking can be a little messy, and that's certainly a lesson for us for the future with understanding these data sources. From there, we also know that almost 6 billion goes directly to other entities. So this is a nonprofit that applied for after school care funds and received it directly. This is Head Start grantees, right? That funding doesn't go through the state first. We also found that most of the funding is going through as prime awards, probably close alignment with a lot of those going to state agencies or municipal governments, a pretty large higher education sector as well in the state, and 2.6 billion to sub awards. I think what this really showed us is the complexity of what we would be talking about here in terms of funding doesn't just stay in one place. Now, where does the funding come from? We took a look. These are the top 6 agencies of where the sources of the funds are coming from. Not shocked to see that HHS is the highest up there. This does include Medicaid funds at the state level. We're not able to then track it to the local level. I'll also note that with the USDA, to remember that the bulk of our country's food security programs live within USDA, not HHS or ED, the school meals programs. And so those are represented within there. But we were pretty not surprised by the agencies that came to the top of the list, though perhaps the amounts and sometimes was surprising to us. From there, we could then take our analysis because it's available down to even the zip code level of grantees, and we could start mapping out where is the money going. This was a critical question to us. So for those of you not familiar with the state, right there, that star in the center is Columbia. Richland County is where the capital is. Greenville County is up here in the northwest. We're a little bit darker in terms of the amount of money. And this is Charleston over here, which has a robust philanthropic sector, higher education, and a lot of international commerce through the ports. Um, Again, not surprised to see that the wealthiest and most populous counties were getting the most money. But what we really took from this is that every county is impacted by federal funds. What do we do with this information now? And this is where it's really been exciting for us to dig into this. We can tell the story of a community. And I'm just going to put these up very high level, but this is our funders in Spartanburg County said to us, help us better understand for our grantees and our board members, what's at stake if federal funds are impacted in Spartanburg County? What programs are most at stake? What can we do to help bolster these? So we're able to then pull up the dollar amounts and the specific funding programs down to the CFDA level for those of you who are familiar with how federal funding processes work. And we're able to say, not just that Spartanburg gets a lot of money from the Ed department, but that, we have over 500,000 going in there for 21st century community learning centers, which is after school care. That tells our stakeholders, our partners, our advocates, we can't risk this money disappearing. Let's put our advocacy awareness here. Sometimes that then meant reaching out to elected officials. Other times that meant coming together with other grantees to figure out what are you doing to fill holes in your budget process? What are you doing to prepare your team with some funding uncertainty? Where are other places we can look in the sector to help fill some of these gaps? We can then also, like I said, connect grantees to build advocacy power. This is using the 21st century community learning centers as well. I think there's 34 recipients up here in the state of South Carolina that receive funds to provide after school care through these. We want to make sure that they all know who each other are and that they can find each other because we know when you submit federal comment, right, to the government, you're one comment. If your organization goes and meets with your elected official, you are one organization. But when a collaborative of organizations can come together and help stress, this is the impact if we lose this funding on the children served, on the local economy, that starts becoming a much easier partnership to build with those elected officials. It also helps the philanthropic community to see where folks are united around common concerns and common causes. The philanthropic community right now knows that it's being turned to at a higher rate than ever before. And it also knows that it doesn't have the resources to cover some of the gaps that we're concerned about at the federal level. So information able to help the philanthropic community triage, get to know partners, and build those relationships is also tremendously important. And then for this audience, I'm really excited to share that we're beginning to explore how we can align our data down to the local level with the same data sources that the Shortchanged Project is using. So of the data sources that Michelle just shared, they're pretty lengthy list. There's right now only 3 that we're able to track into the local level. Everything else ends at the federal level. And that's special education preschool, C campus, which is childcare for college students with children, and Head Start. we're able to then start pulling these numbers together for those specific funding streams, which then is going to allow us to use our methodology to start aligning with some of what Shortchanged is doing with that 0 to 3 versus, 3 to 5 funding dynamic there. It's going to let our data better interface with other data. I don't think any of us just rely on one source of data in this work. We're constantly combining from other sources. And this was a really exciting next step for us to take. So with my last minute here, I'm just going to put up very briefly what we've learned, and this is something that maybe will come up in the Q&A. You can't navigate without a map. Funders, partners, others in government didn't really know what the full funding landscape looked like, and somebody had to take the first step to do that, and we were happy to be those. Relatedly, organizations are ready to leave their silos on advocacy. People realize that even if they do not receive, if they're not related to SNAP operations, changes to SNAP funding impacts the families that they serve through their after school program, through their child care center. They want to get engaged. They just don't always know how. And this is a first step towards some of that engagement. And with that, everybody has to step out of their comfort zones. When we look at children, we focus prenatal to age 8, health, home visiting, early childhood education. All of these things are connected at the systems level. Sometimes it's difficult to get our data to work at the systems level, but it's an important step to push towards. Then on the data side, there's always more data available than you think, as I think Michelle and her team could attest to, but it might be incredibly messy. And it's really important that we put the time and energy into cleaning this. It cannot just be automated. We had to check, with a real human eye towards a huge number of human errors that were made. If something like if a grants officer puts the wrong county in on someone's paperwork, then they're counted in the wrong place. So really bringing folks together who want to do this work and get to the bottom of some of these mysteries so that we can better understand what the landscape looks like. Thank you.
All right. Well, Joan, I would love to hear your
Oh,
thoughts
wow.
and your reactions to all of this.
Wow, this is a lot. So let me start with Michelle and her book. I want to give a plug because I'm a history buff. Theresa mentioned it in the beginning, but she's got this book coming out. I was lucky enough to do a pre-read. It's terrific. And we've got to remember our history. When I hear all of this, I am absolutely amazed at the data that we have now. So thank you. And secondly, Megan, thanks for your work originally with NEAR, because I think they pioneered on this data collection in many ways. And I'll just mention that your example, digging down and connecting this with advocacy is really the next step. So congratulations for taking that step. I'm going to bring us all the way back to the shortchanged data and just remind everybody, because I had to do it myself. I asked Michelle, send me back all the reports you've done since October 2024, when the first one came out just with the national data. And I urge all of us to go back and read the sequence of these reports, because first they did the national data, and just having those categories that Megan then used was a critical first step in defining what are we talking about here when we talk about care and education. Then in December 25, when they added the state-by-state data, that was such a big step forward. And then more recently, comparing that to the percentage of federal dollars to that state dollars, it's just a landmark step. So I want us to stop and go back through those reports and think about how you can use that data, because this is coming at us so fast, like a fire hose of data, but we have to stop and reflect on it. I want to make 2 points before I turn it back over to Theresa. Number one, just to remind us, this is early care and education data. Early care and education is not the only thing that impacts children and families. And so there's health data, there's family support data, there's all I talk a lot about neighborhood conditions, housing, and other safety issues that are facing children in neighborhoods, all of those things, and the data that impacts them, climate. is really critical. I think you heard that in Megan's presentation when she started with all the federal funding streams across health and education and family supports. We just have to remind ourselves of that when we're using this big data set that's critically important, but it's the whole data. The one thing I've seen through this terrible last year is exactly what Megan said. The silos are breaking down in the advocacy community. I know we're seeing that at the federal level when we look at Medicaid advocacy along with SNAP advocacy, along with Head Start and childcare. That's a good development in the midst of terrible disruption, which sometimes happens. I guess my last point before I turn it back over is that this report, I'm urging all the state advocates to have like a book club, like a report club, where you take all these fact sheets. I mean, Michelle talked about those fact sheets that you can just download from this data set and put it together with some of the other state by state reports that you have. And I would urge all the funders, if they're listening, to help support advocates in this effort to look at, for example, the prenatal to 3 policy roadmap, which has state by state data across the policy areas that we know has evidence. The Alliance state by state data just recently came out, their policy progress and landscape report. So if what we just heard was the numbers, the funding expenditures, then you've got the policy pictures by state. So you've got to kind of gather all this up and curate it for your state. And then I would add, Michelle, if we could just put up that last slide, the most recent piece in this, and one of the most important ones, is the data that's coming out of the Healthy and Ready to Learn survey. This is state by state data now. This is the national data, but there is state by state data that is telling us how children are doing at 3, not at school entry, but at 3. So if you put this is like almost 40% of the children not on track. And we can debate, the word ready. I have done that many times. We know it's not so simple, but there is the corollary of this state by state. So the bottom line is you have funding levels, you have policies, and you have outcomes for children, state by state now. Put that picture together, have a little, coffee, and invite people over to look at it, because it's going to take time to absorb this all and paint a picture of it before you take the next step, which is tying it to the local level, the way I think we just heard in the example from South Carolina. So I'll stop there. Amazing, amazing progress.
Well, I have the privilege not just being everyone's host today, but also being a little bit of a discussant here and looking at this great data and thinking about it. And when we think about strategic financing for a system, especially early care and education system, it really requires that 4 critical things, right? You need to know how much money you need. You need to know how much money you currently have. You need to have some good ideas of where maybe to get more money from. And then you have to have good ideas about how to spend it well if you do have it, right? That all those are really critically important. And what I loved about what Megan presented in the South Carolina work is mapping where that funding is coming from is so critical, and then mapping that down to the local level, understanding where all these funding streams are coming from. A lot of those funding streams, they do have very specific things that they have to be spent on, but so many of those funding streams have tremendous flexibility in them, and they may be being spent on some other kind of priority, but at the local level, there's a lot of control over how you can spend that money. And so knowing that those funding streams are there, that they're a place where you can go and have community discussions at that local level. Can we devote more of our social services block grant, our community development block grant towards these critical needs? So I think, and you just can't think about that at a state level. It's like that is the work that has to happen much more locally, because it is those local people who actually have control over how those funds are spent. I also think that like looking at all the funding streams together and at a local level, we've done some of this in Illinois and for the city of Chicago at CELFE, where we've mapped out all of the money and where it's flowing, and then kind of compared that to the number of low-income kids who live in any given geography to try to see how evenly the peanut butter is spread. It's a very thin coat of peanut butter to begin with, but boy, is it lumpy. What we learned and when we look at it, that we see that it isn't evenly spread out by where all the low-income kids are. It's actually pretty bunched up, but we call it lumpy funding because we don't want to go there with the like somehow that this is nefarious, inequitable distribution of resources. It honestly, it's probably mostly because there's just nowhere near enough resources. It's like the lawn has a lot of patchy spots in it because there just isn't enough to go around. But it's important for us to understand where that money is flowing now, because if we are able to put more money into the system, we need to understand how these pipes are actually sending money out there, because the next round of money often follows exactly where the first round of money went. Instead of going to the patchy brown spot, it goes to the green spot, and the rich get richer, and the poor stay poor on these kinds of funding streams. So all of this work of tracking the money is critical for how we build the system and move it forward, how we understand, again, how much more money we need in the system, how we advocate for that, and how we make sure that if we get the money, it actually goes where it's most needed to fill the next hole. I have to say that, like, looking back at the Shortchanged Project and the data that was presented today, I mean, the big takeaway for me is that we're not going to solve this problem of not enough funding in early care and education with one level of government. This is a federal, state, and local issue, and it needs to be addressed on all of those fronts. We need funding sources that are in all of that, in all of those directions. I was also really struck at how few states are actually investing their own money in infants and toddlers. And that is really disturbing to me. And as you look at what's happening, and most of that money, let's just be honest, some of it's in early intervention services. Most of that money, when states are investing, it's childcare money. It's just straight up childcare money. If you look at what's happening in states across the country as they are needing to pull back a little bit on their investments in, or choosing to pull back on their investments in childcare, a lot of the strategies by which they do that are gonna hit infants and toddlers worse than they hit the older kids. Freeze your entry into the system. Start creating waiting lists. Well, who's going to go on the waiting list? It's going to be the babies that were just born, right? Disproportionately, because they couldn't have been in the system before. They just were born. If you start cutting rates, who's going to be disproportionately affected by that? Well, a lot of preschool programs can scrape by with it, and maybe already are making a little bit of profit from what they're doing. But the infant toddler rooms are sure as heck not. They're lost leaders in the first place. And if we cut the rates, they're the first ones that providers are going to be like, I really don't need to take those subsidy kids anymore. So we're in a trend here if where states may be even pulling back unintentionally pulling back disproportionately on infants and toddlers. So as you make your cases in states about, there is no great way to spend less money, but there are particularly harmful ways to infants and toddlers, to the things we're doing. And so looking at all of that as we go. Yeah, and wow, only 18 states are actually investing more than is required in the Child Care and Development Block Grant. That's a telling statistic. The federal government has a lot of power to encourage the states to put in some money so that they can draw down the maximum federal dollars. And I'm sure there are states out there right now who don't have a plan to put enough money in to draw down all the federal money. But boy, they're going to need to go above and beyond what is just federally required if we're going to start to build the system that kids, families, and communities deserve across this country. So So going to open it up for a little bit of conversation here. Sarah's going to ping us with some questions that she's finding in the chat. So Sarah, if you could let us know as you find some good questions there that we should be addressing. But in the meantime, I'm going to ask a question for some of you, and I'm going to ask you, Michelle, what you talked a little bit about this, but what really stood out to you about the relationship between the state and the federal funding sources as you look across the country?
Well, Theresa, it'll be no surprise that what stood out to you is what stood out to me, um, in just how little states are investing in infants and toddlers. That um, when you look at the entire system, it's kind of it doesn't look so bad, and then you disaggregate by age, and it's really, really clear that where state money is going is to state pre-K. And the good news of that is that there's been a really consistent advocacy effort over the last 20 years to push for state pre-K. So that seems like it's working. That's great. On the other hand, infants and toddlers are the most expensive population to serve, and getting the fewest resources. And particularly in the unstable federal funding landscape that we find ourselves in, that's a pretty precarious position for them to be in.
Yeah.
Yeah.
Let's do the same, Joan.
Yeah, I mean, I can't say that I was surprised of the reliance on the federal dollar. And we've known that that's been kind of opposite of what we've seen in education. We haven't seen as much reliance over the years, although it has a big impact on equity from federal dollars. So I wasn't surprised. I think I'm saddened by the fact that we're not investing in infants and toddlers, as Michelle said. And, again, pulling on some of the material we have to advocate. I mean, 0 to 3 has been a drumbeat of information on why that's so important. And we should bring that into our book club. What I think the numbers don't tell us, but what we're seeing, at least through the rapid survey, is the impact that this lack of financing is having on the workforce. Over the last, the first 4 years we were doing the survey of providers, we found that more than half of the providers were experiencing, on average, one material hardship. And recently, in the March 25 data, 2 out of 3 providers having difficulty meeting basic needs. What is that translated to? It's stress on them, and then that comes into their work with children. So, again, I think we have to put these numbers together with what we know about child development and paint a picture for what that means.
Yeah, and I found myself thinking a lot about blending and braiding, and how blending and braiding is such a cute little term we've come up with in the field, right? And we blend and braid funding because it, creates more sustainable funding, right? You're not just beholden to one funding source, and that's critical right now. But when you're cleaning by hand sometimes all these data and figuring out, how does this one align with that? And oh my gosh, 2 different agencies were involved in implementing this. And you start thinking about how much is lost to bureaucracy, right? And we need some degree of bureaucracy, right? Unpopular opinion. We need to track things. We need to know funding is going to the right place. We need to track outcomes. But that we always seem to find more money for bureaucracy and monitoring, and we don't always seem to find more money somehow for the programs themselves. And that was just kind of really sticking with me. I think also too, just the critical role of, third sector organizations like ours, obviously, right? I'm a little biased, but, other researchers, universities, to be able to take on this data and try to make sense of it. Blending and braiding is complicated. It's critical for breaking out of the silos a little bit, but really thinking about the amount of work that goes on under the hood to make programs work, the amount of data that runs through states about how money is being spent. And that doesn't even really capture, there's a lot of local spending that doesn't need to get reported to states. And I think that that's sort of one of the new, frontiers in the data collection. I know NEAR has really been following this very closely, and stepping up the field's focus on that. But even for all of the information that we have, there's this big X factor that we still don't have. So we're closer than we've ever been to a comprehensive sense of the federal, local, state interplay. I feel excited about where there's opportunities to learn more and keep building those systems. That might be one of the good news feelings I'm taking away from this.
Well, and I think that just to build on that, Megan, think of what program directors go through. I mean, they're the ones that really
Yeah.
we should be listening to about their shortfalls and
Yeah.
how these funding streams flow. Because I think we're learning a lot more now about how these funding streams are implemented in states differently. And we're seeing a lot of differences where states are able, I heard a panel this few weekends ago at the NAOIC Policy Forum with states that were investing in their workforce compared to states that were not, and what the whole supply chain looks like because of that. And
Yeah.
so that again, I think is a new frontier along with the community data.
One of the questions that came from the audience, I think, is really interesting, pointing out that there are actually some locations and some cities around the country that are hugely investing. And Washington, D.C., which is quasi city state, comes to mind. But certainly San Francisco, New York, you're seeing step up in a huge way. Philadelphia, Denver, like a lot of places that have built out systems of investment in early care and education at that local level. And the questioner is asking, do you think that when that happens, that it actually becomes a little more stable and that there's more buy-in or maybe more political stick-to-itiveness? The question was like whether philanthropy actually helps to push that and keep the sources going. But I think interesting question overall. When you go local, do you think that you build something that maybe doesn't have as many ups and downs? Does that make a difference?
It's an interesting question. I mean, I think my own work globally says local helps with sustainability. I just think you get people involved. What's exciting to see across the country are these place-based strategies where you're seeing a cross-sector coordination coming together and saying, how do we make this the best place to raise a baby? And they're coming together and looking at outcomes over time in a population way and looking at the funding stream. So I do think there's something, and we really need a big shout out to the Children's Financing Project and all the work they've done locally.
Absolutely.
Yes, that is actually. I'm gonna ask if we could share a link to some of their work on voter-approved children's funds. This is a fascinating question. It's one of my favorite questions. We rely on their work tremendously, but we're hosting a capstone group of NYU graduate students right now at ICS working on a paper related to this and trying to put together an advocacy guide, right? You basically, for the person who says, I hear that there's ways communities can fund early childhood. How do we start? How do we get involved in this? Where are we looking? And I think that sustainability piece, right? There's financial considerations with that. What if you're doing a permanent fund or a tax, you have to make sure it's a stable funding source. But I think that there is a real local buy-in piece. One is that it's just human nature. We feel more connected to programs we can see, to things that we can see. And so even if I'm not necessarily enrolling my child in the program or passing the child care center, it's on my local news. It's, I'm seeing the effects of that. I'm hearing my neighbors enrolling their children. So there's sort of that connection that builds. The other is that, with these programs, whether it's a voter approved initiative or some other mechanism, you've already had to build a lot of local consensus to get there. You probably do have philanthropic support, maybe Chamber of Commerce support, parent groups, teacher groups, business. Um, you already have that buy-in. And then you just have to work to maintain it, right? You can't just take it for granted. You have to continue to maintain that buy-in. You have to track outcomes. You have to message what's working. You have to be open to feedback. But, at the local level, here in New Jersey, if Trenton passes a new program tomorrow, there's no guarantee that my city wants to do it. When you create your own programs, you sort of created a very supportive market for it. It's hard, obviously. And then, like we were saying, that data tracking piece, as these initiatives grow, it's harder to get a sense of how much money really is out there. But I think all local communities should be, assessing to some degree what their ability is to earmark funds or set up dedicated funding streams. Because I think, frankly, we were saying before, the feds can't solve this all, the states can't solve this all. We really do need to be thinking as creatively as we can for the future.
Yeah, I mean,
And I'm gonna jump in just because as a former state person, right? So worked at in the governor's office. I mean, I love this, and I worry about the extreme patchiness of this that may result. I mean, we've seen in K-12 financing with a huge local component that a lot of inequities can exist. Over my career have worked a lot on the issue of suburban poverty and really looking at the difference in services that are available to kids in poverty in suburbs, especially, where I live and it's suburban Chicago, versus in the city itself. And that this is what I worry about, right? That cities are able to pass these kind of investments, put the money in. Those outer ring, inner ring suburbs with just tons of poverty may not be able to do that. So if we need more money in, we need to be careful about the equity of it. I also think that, the governance issue of who's in charge then at the local level, and how do we make sure that every part of every state has local governance over early care and education, so that we can bring local decision making and local funding to the fore across. Well, we're getting close to the end of our hour here. Michelle, are there a few things that you want to give as a stay tuned and preview for the Shortchanged Project as we close up here?
Yes, absolutely. So we just published our final FY22 report, which please go download it. We hope you'll share it and find it useful and interesting. We are working furiously to collect and analyze FY23 data, so that we can get out of our anomalous COVID years and get back to our current reality. So stay tuned for that, May or June of this year. And then we're also, really, as I mentioned, we're really trying to build out our state and local partnerships, both to make sure that our numbers are correct, but also because, we really want to understand the historical and political context in each state and locality. So that's actually how Megan and I got connected, is she reached out after one of these webinars, and now I know a whole lot more about South Carolina than I ever would have just sitting in Chicago. So again, we're really working out to build our local rosters. So please do connect with us about that. And then, phase 3 is to use some case studies of cities and localities that are doing this well, and lift some of those up. So catching back up to speed and then drilling down to local. And Joan, I loved your suggestion about like book clubs and helping people to pull all of this data together, because we know that so many of our partner organizations are doing really complementary work. And it is a lot of work to put the onus on advocates to put it all together themselves. So I really want to think through that as well.
Yeah, I just want to remind people of what Theresa said also. We do have to keep our eye on that federal landscape because we are so dependent on it. And we absolutely cannot let down our guard. We should be having increasing dollars in early care and education and less dollars in other areas that are not creating life. Leave it there.
Amen. And we'll thank you all for joining us. And please keep in touch with us at our project. Visit our website, learn more about what we're doing. Love to have you on our mailing list for CELFE. We, in addition to the Shortchanged Project, we put out a lot of briefs around thinking about the financing of early care and education. If you're interested in any of our topics, please do reach out and talk to us. We love to partner, and we love to support all of you in the work that you're doing for kids and families every day. So thank you.
Thank you.